Good afternoon, everyone. I'm Governor John Carney, and we're here again for our bi-weekly press conference to talk about Delaware's response to the COVID-19 pandemic. And at the top here, I just want to salute the Thunderbirds and Blue Angels who saluted our first responders and healthcare workers and everybody out there working on in essential businesses, all the folks public health working there at the shock on a day-to-day basis, all the hospital workers working at our hospitals across the state from north to south, all the first responders and emergency service personnel, all state employees who are still working, all municipal and county employees who are working, and really everybody as we've tried to pull together as a state and as Delawareans to address this pandemic. You know, I know we've all been touched in a very deep way with the sadness of losing loved ones, those of us who have had family members and those of us who've been COVID-19 positive, all the trauma that is caused to each of us and to our families. You know, now's the time for us to pull together as family, as neighbors. We are a state of neighbors, and we take care of one another. And really, when you cut through a lot of what we talk about at these briefings, that's really fundamentally what it's all about. And that is protecting one another, lifting one another up, seeing the really good bright lights among the darkness. I heard on the radio this morning two sisters talking about their father who had died in the hospital at COVID-19 outside of Philadelphia. And they weren't able to visit their father as he was on a ventilator and gradually slipped away. And I remember my own father when he passed, not by COVID-19, but similar fashion on a ventilator, and just wasn't able to hold on. Had had a wonderful life with a beautiful wife and 9 children and scores of grandchildren. I can't even keep count. And my heart ached for those sisters as they lamented the fact that they weren't able to be with their father at that moment. And we've had families and individuals who've suffered similar tragedies here over the last 2 months. And I also hear the anguish in the small business owners, family business owners who've worked in the business for generations, all of their lives. Most of them have built up a secure way of life for themselves and their family by working hard, by going to work every day, 7 days a week, sometimes 365 days a year, and just know how hard it is to see the damage that they're experiencing. And so for me as governor, it's not just about the statistics that we talk about here. It's not just about the organizational structure of response. You know, my job is in part to understand the pain that people are feeling in their hearts and at their homes, and to try to factor that in to the extent that you possibly can to our efforts to respond to this pandemic and terrible situation. I'm lifted up every day by just unbelievable acts of kindness and fearlessness and commitment and dedication. I think of our hospital workers who've been out there day after day for weeks on end now, testing now over 21,000 Delawareans with all the personal protective equipment to protect them from this virus. And I think of the first responders who drive the ambulances and who respond, and I think of the people that come by my house twice a week and pick up the trash and recyclables at the curb, and I think of everybody else that has to be in their post in our 24-hour facilities and the rest. And so as I hear from all of you about what we need to be doing over the next several weeks and trying to gradually reopen, gradually go back to normal, I want you to know that I think about that pain, that trauma, that suffering that we're all experiencing. And I also think about those who have passed away as a result of this terrible virus. And so my heart aches when I think about all of that. And I try to make that part of the decisions that we make on a day-to-day basis. So with that, why don't we move into talking about the numbers again. And again, behind these numbers are real people, real families, communities. We're up to now over 4,500 positive cases statewide since March the 11th. We're now up to 137 deaths statewide, and a positive number over 1,000 recoveries. So the way I like to look at it, I take that 1,000, almost 1,100 recoveries, and I subtract it from the 75 positive cases to make me feel better about where we are. We have 337 hospitalizations, and AJ's going to talk about that, but we still feel pretty good about where we are, I think, on hospitalizations, with some obvious concerns with respect to critical care capacity in the lower part of our state. Over 1,700 cases in Newcastle County now, the county with the second most behind Sussex County, 728 cases in Kent County, and then 2,114 cases in Newcastle or Sussex County, and more cases there, and of course a much smaller population, so significantly higher infection rate there, and we still have unknown locational positive cases. So again, just a brief outline there of the positive cases by age, and again, that broad middle age group has the most positive cases. Still, very few children, infants and children and teenagers there, still under 200 total with those first two categories. And of course, the most vulnerable population, where most of the deaths, almost all of the deaths, are in the 65 and older demographic, and particularly those with pre-existing health conditions. So just to take a look back and a brief look forward with respect to our projections and our trend, where we've been, you see two lines that rise above the bar graphs, which were earlier projections about where we would be, the first April 14th line, and then the April 22nd line, and then the yellow line that we're working on today, just based on assumptions of the percentage increase each day in individual cases. You'll see that the number 4575 for today, that number is a little higher than the line, so it was higher than originally projected, and then it evens out as we move there. And we still continue to look at hospitalizations, and again, if you look at hospitalizations relative to the number of cases, they still are lower than we're projecting, and that's a very good thing and a very positive thing. And important to note here, I think, that it will be one of the indicators that we'll look at as we start to evaluate the conditions on the ground for reopening in a phased approach. Again, the next slide is a series of projections that we've had over time. Again, a much steeper curves earlier on about what was expected, going back to the trend of April the 8th and moving forward to the April the 27th trend, and what it looks like ahead of us. And again, other than this little uptick over the last couple days, which reflects the spike both in additional testing and additional positive tests coming out of Sussex County, we're on that gradual slope upward. What we want to see is that curve flattening out and then coming down the other way. The next slide is just the two-graph representation of that. And here's the one that really we'll start to focus on more and more, and that is the day-to-day count. And if you take out the two big spikes there, 458 and 413, you have a trend that rises gradually. And again, we need to remember that part of the fact that it looks a little bit inconsistent is the way our testing's been done, not every day, not all hours of the day, and with different intervals of getting the test results back from outside labs, anywhere from 3 days to 2 weeks, 10 days or 2 weeks. And so you tend to get bunches of results, and that's somewhat why you see those little blips up. And we're going to try to smooth that out with some statistical techniques, and also start to look at the percent of positive, because we're doing more tests every day, and so you're going to see more positive cases. And we're also over-testing in areas where we know there's significant spread. And so we'll have to take that into consideration. The next is just a bar graph of the more recent days to give you a clearer idea of where we are. And if you take those spikes out, we've kind of maybe crested a little bit, starting to flat out a little bit, but the fact of the matter is we can't ignore those spikes, and in fact we have to respond strongly to them. And that's where the next slide takes you to the heat map, where you see the spots where you have the most positive cases per the population. So low population, low denominator, if you will, higher numerator gives you a higher prevalence there. So it's rate of cases per 10,000 in the population, and that Georgetown, Millsboro, Seaford, kind of 113 corridor westward to 13 corridors where you see. You do notice too that if you go east, kind of east of 113, not as intense as it is of west of 113. And so obviously important areas for us to respond to. So it's a very serious situation, and as we look at statewide, a bit of a flattening in some of the cases, arguably healing, getting better. It tells us that the actions that we've taken to impose restrictions to movement and large gatherings has helped with respect to flattening the curve, reducing the spread. Obviously, we have a very intense spread within crowded communities in Sussex County that we're responding to. We've had, in the one testing site we had there in Sussex County, about 35% of those tested were COVID-19 positive, which obviously was a very serious data point for us. And so our response will be increased testing, both in employment centers and in the community outreach and education, to make sure that community members, particularly those in these communities where we've identified the high rates of infection, will get information about isolating those who are COVID-19 positive and protecting other family members and other residents of those communities. And a series of urgent communications that we will be getting out there for all Sussex Countyans to stay safe, to make sure they're social distancing when they go out, to stay at home, and social distancing when they go into the public, and to protect each other, protect seniors. So the challenging part of all this, and I say to people all the time that we've had really difficult decisions to make as we close down segments and sectors of our economy over the last 6 weeks, and we'll have the slide next that shows the actions that were taken on the emergency declaration and all those amendments. The decisions that we have ahead of us, kind of to put out the fire in the hot spots of COVID-19 spread, particularly there in Sussex County, and at the same time work on reopening the economy and sectors in a phased and safe way is going to be challenging in terms of decision making, and it's going to require a lot of public engagement, which we've already started this week with Zoom calls, pub town hall meetings, if you will, to small business communities, to various communities and sectors across our state, working with in geographic areas with members of the General Assembly, several of whom were on the call yesterday, starting in eastern Sussex, and then the messaging that's going out about the situation down there. So this next slide here just talks about the conditions that we need to see, and 14 days of declining symptoms and positive cases. And really the measure for us on that is going to have to be, since we're doing additional testing, and I get a lot of questions about this, as we all do, you're going to have more cases, and so we have to correct for that by using a measure of the percent positive of the tests done, and to see a decline in that. And importantly, something that we know of, because we communicate with the hospitals on a regular basis, and I can't say enough about what our hospitals have been doing and will continue to do in terms of testing, treatment, and all of the rest. We know who's in the hospital. We don't completely know who's infected with COVID-19 in the community, and what stage of the illness that they might be in, and whether they're contagious or not. But we know people that are in the hospital, and that number continues to track lower than our projection. And we'd like to see that number start to trend downward, importantly, as a condition of moving forward. So to get there, we need to have widespread testing in place. Two of the really important things that we're working on right now, in addition to trying to put out the fire there in Sussex County, is to design a more robust testing system that Dr. Rattay and her team are working on, to make sure we're able to test maybe twice or more of the number of people that we're testing now, so that we're able to open the economy and economic sectors safely and gradually, based on advice and guidance from the White House Task Force and CDC. We also need to have in place increased and enhanced contact tracing. We do some of that now, but we're going to need several times the number of contact tracers and an organization to deploy those community health workers on the street, especially with focus on vulnerable populations, our seniors, our nursing homes, our low-income and crowded communities in every area of our state. We also need to have adequate supply of what we refer to now as PPE, personal protective equipment, for hospital workers, for our first responders, and we feel pretty good about that, although as we move towards mandatory mask wearing, that'll be continue to be a challenge. So all of these things need to be in place as we reopen, so that we can go back to work, eventually go back to school, open up summer activities hopefully at some point, and do it in a way that's safe and that doesn't result in what the experts refer to as a rebound, the virus coming back and threatening our population again. It's just the last slide, I won't go over it at all, is just the series of measures that we've taken from March 11th to close down the economies, and the most recent amendment to it requiring masks in public settings, and identifying Sussex County as an area where we want to focus our energies and attention for testing and for outreach. And so with that, I turn it over to Dr. Rattay. And again, I can't thank Dr. Rattay enough. I don't know how she does everything that she does on a day-to-day basis in terms of fighting the fire of the outbreak, working on our new testing plan, working and envisioning on how we move to expand by orders of magnitude our contact testing, doing all the public engagement and engagement with elected officials, you must not sleep at night. That's the only thing I can think of, but you're doing a great job, and our hats go off to you, and we thank you very much for that.
Thank you so much, Governor. So I want to talk a little bit about face coverings. Thank you, Governor Carney, for making the wearing of face coverings mandatory this past Saturday. I've heard since then a lot of questions as to why we would do this, why we would do this now. This virus is a virus that we are learning more and more about all of the time. And one thing that has surprised, I think, all of us in the public health world is that asymptomatic spread of this virus is so much more common and prevalent than we ever imagined. I had the opportunity to speak with the CDC director, Dr. Robert Redfield, on Saturday, and he said that they believe now that that's the most predominant form of spread of this infection, which is not something, again, any of us expected, but it also is why face coverings are so very important. When we sneeze, when we cough, and even when we speak, we have droplets that come out of our mouth. And that's really the primary way that this is spread from person to person. So face coverings can make a really big difference, and that's especially the case if you don't know if you have COVID-19. So when we say face coverings, we are not talking about medical masks that are the same very masks that we've been talking about for quite some time that are hard to find. We're talking about cloth face coverings, and now at this point there's about 1,000 or more ways that you can find, buy, make face coverings. Somebody was telling me they cut a sleeve off a t-shirt and used it, pulled it around their neck and up over their face and their nose and mouth, and that's what's really important. It's got to go over your nose and mouth. You really want it to be comfortable. You want it to be something that you can breathe in comfortably. It's great if it's something that you can wash in the washing machine. Wear it during the day. Try not to touch your face when you have it on. You want to do hand sanitizer before you put it on, after you take it off, so that you're not spreading. But the reality is this is probably going to be the way of life for us for quite some time until a vaccine is widespread. And so it's important for people to just start thinking about what you would be comfortable wearing on a regular basis when you are out in public, when you are shopping, when you are, certainly in any public business, when you are in any location where it's hard to social distance. That means if you're even outdoors in a public space where people are at all close to one another, you should wear it. And if you're walking by yourself on the trail, you don't have to wear it. If you're running, biking, you don't have to wear it as long as you're social distanced. For many people in the work site now, especially if it's hard to social distance, if you're in a room where you're meeting with individuals where you are less than 6 feet apart, you need to wear a face covering. So again, thank you, Governor Carney, for signing that order on Saturday. I really think that that's going to be helpful in preventing a lot of spread of infection going forward. So as the governor was saying, we are very concerned about the high infection rates that we are seeing in Sussex County, and it is really important that we do everything we can to address this situation. Testing is really important. Testing helps us identify who's infected, and then it helps them so that they can be isolated or separated from other individuals. And as we learn that, then we can help understand who they've been in contact with and help them be in quarantine so that they're not exposing other individuals. So we are doing a lot of work in partnership with the hospitals and many community partners in Sussex County who have all stepped up and are rising to the occasion to really help support this community. As was announced just a little while ago, in partnership with Bay Health and BB and Nanticoke Hospital and our federally qualified health centers, Westside Health and La Red, and a number of other community partners. There are new expanded testing sites that are intended to reach our highest risk populations, so those with symptoms consistent with COVID-19, and especially those who are either working in one of the industries, not only the poultry industry, but landscaping or construction industry, but also the family members or housemates of these individuals. Certainly anyone who's living with an individual with COVID-19 should seek testing at one of these sites. What we feel is important with this is not only is the testing is important, but as soon as possible, once you've identified the test, and so we're doing some testing where you can get the results right then and there, then we do what we call a case investigation, so we can better understand risk factors and if a person can isolate safely, and then we connect them to the services they might need through a resource coordinator to help support them, as well as educate them and give them a care kit so that they have face coverings and hand sanitizer and soap, thermometers to monitor their temperature, and household cleaner as well. So again, all of this is to really turn this around and decrease the spread of infection in Sussex County. We're really grateful that the Centers for Disease Control and Prevention has sent an EpiAid team to Delaware. They all arrived yesterday. A fantastic group of really smart people. We have a number of scientists. There's 5 individuals who are with us who focus on epidemiology and laboratory science, as well as occupational safety and health, or NIOSH. And so they've already, several of them are in the poultry plants today. They're looking at our data, and they're really helping us to quantify and understand the extent of the spread, the transmission routes, and also help us think of what are the other ideas that we should put in play to mitigate and decrease the spread of infection. Testing in our state, we've talked about it an awful lot, and I'm again really proud of the hospitals in our state who have all stepped up, and we're now over 22,000 states across the hospital testing sites that have been stood up. In our own public health laboratory, we have performed almost 3,000 tests at this point, 726 positive and 2,229 of these negative. So again, testing is really important. We've done a lot. We're going to be doing a lot more in the upcoming months.
Dr. Rattay, thanks very much. Thanks for that focus, and it is great to have the team from CDC in to help us. So we've had quite a bit of outreach to the White House Task Force, to the CDC, working with employers in Sussex County to figure out the best way to test employees and workers there, to deploy our resources to try to get our arms around the spread and to protect families and residents and communities there, and ultimately to eliminate, or not eliminate, but at least contain the virus there, so that we can move back and open up in a phased kind of way in different sectors of the economy. Thanks for all the great work that you're doing. AJ?
Thank you, sir. So we talked about the testing and how important it is and what we know we have to do when we come to that. And I think Dr. Rattay and the governor did a great job going over that, but I think we also talk about hospital capacity. And that is something that we probably has one of the true and the quickest turnarounds that we could have an understanding of what's going on across the state. We also have to understand our data and how it changes, and we make assumptions, and we make, from that we're able to plan. Here we have a slide that was from Sunday, which shows potential, what we thought would be the hospital capacity of COVID patients, those on ventilators and those that would be in the ICU. And I put a little arrow on there where it was supposed to be if we went back a week. So a week ago Sunday, so on the 19th of April, we were looking to be somewhere around the high 200 marks. As you see, there's a range there. So Last week was bad. We know that. So not only were we seeing more positives from increased testing, we also kind of missed our benchmark there by a little bit, and we're a little bit farther north of there. We hope that we stay below. We don't have a story like this before, but this just shows that the hospital is a very important part of what the response is. It's also important that we stay at a point where the hospitals can respond to and treat these patients in the best capacity they can. Next slide just shows how this has increased over time. So on April 10th, we had 184 individuals with COVID symptoms in the hospital. Go a week or 10 days later, we were about 260. And then I believe this is from yesterday, but as of noon today, we're about 337. So this trend continuously goes up. So as we see some stability in the testing, we still have to very closely watch what our hospital census is with COVID patients, as to make sure that they don't get overburdened and unable to treat them. We still have capacity in the state. We are concerned with some of the growth we're seeing downstate in Sussex, as we saw last week. However, the hospital partners continue to work well together. We are ready to send the National Guard in to assist, kind of just be that surge force to assist if needed. Inter-facility transports to get patients to other facilities in case others are getting close to capacity or over capacity. Not putting any of those into effect right now, just getting them ready if and when we have to initiate any of them. I'll talk for testing just for a second. This is actually something, it's one of those good things that we're coming to. We know that we have to ensure that we provide testing to our healthcare workers and first responders. In the Office of EMS under Public Health has recently partnered with the county paramedic agencies in each county to train them and allow them to do some testing. So this will hopefully get testing to first responders quicker without having to either go to a lab or the hospital. So Diane Hainsworth and her team is working with the 3 paramedic agencies. So if you have a exposure issue, if somebody has symptoms, they could possibly get tested quicker. So again, as we could push this out in the community, we want to make sure we hit as many avenues as possible to become more diversified. And then we want to talk about recovery. So the governor talked about the economic opening back up and what we could do. And I think we also then look at the recovery, which is going to take multiple forms. There's what the Department of State's doing, what the governor's office is doing, what the Small Business Administration programs we've seen. And then from the emergency management side, we talk about recovery and how we start recovery before the incident ever happens. And I think we've learned a lot of lessons from the hurricanes in 2017, from the winter storms we've seen, from the tidal flooding we've seen, and what we could do to make sure we help the community. So a lot of times the municipalities respond as quickly as possible to regain some of their expenses associated with that. So the president assigned a disaster declaration for every state back in March. We then requested a major disaster declaration that will bring a few additional programs to the region. We're still working that out with 50 states dealing with this. It's going to be a little bit different than a normal maybe hurricane or snowstorm would be, but we've registered 53 municipalities, nonprofits that would be eligible, fire departments, hospitals, et cetera, to be able to put in for reimbursement, the 75% level to the federal government. So that will help us recoup some of those costs. I've also talked about the Delaware Community Foundation and the great work they've done. They've raised about $4 million today, and they've distributed $1.7 million. So again, we are getting, in partnership with our nonprofits and agencies to get funding out there to make sure they're able to serve the citizens as quickly as possible without any delays in service. And that's important because I think our nonprofits are a huge backstop to our communities, and we have to make sure we support them any way possible, and this will be an ongoing effort. We are looking to sign an MOU with the food bank today to expand some of their capabilities, and we'll look for any opportunity to make sure the state and our community partners could provide services as quickly as possible. Lastly, I want to talk about mental health. So we know that this has an impact on families across the board, from people that have a loved one in the hospital or lost a loved one to those that have had to, postpone weddings or not be able to celebrate somebody's life at a funeral the way they'd want to. To those, we had a huge religious season time of the year that we're just going through right now. And we want to make sure people understand that, we understand this. Our Elizabeth over at the Division of Substance Abuse and Mental Health is working to expand the services that are at the helpishere.de.com website. We have a text option now where people can get to support groups or somebody to talk to, events. We know that in disasters, and that's disasters from something that happens to somebody in their community to what we're seeing now across our country and the world. We want to make sure we expand those opportunities for people to get help as needed. So there is going to be more opportunities that our mental health professionals are rolling out there. But the good news is today is they were able to launch a text option to get people there. If you go to helpishere.de.com, there is a listing of events, support groups, chat lines that people call or get additional information with. We can't take this lightly. We know between unemployment, the medical issues people are going through, the separation, there are a lot of concerns we have with this gap, and we want to make sure we fill it as best as possible. It's not going to be just the state that is able to support this. This is going to take a larger task force with the medical communities, primary care physicians and counselors, and are not going back to our nonprofits. So with that, Governor, I'll turn it back over to you.
Yeah, and I'd like to, before closing it out, I'd like to just go back to the second bar chart on the hospital capacity, because I think it tells the next one. Thanks, Jessica, because I think it tells a story, and AJ referred to it. This is really a hard number, right? We know these people are in the hospital. It's a real good indicator of the people that are seriously sick with COVID-19. We know we're not doing enough testing. We will be as we move forward. Dr. Rattay and her team are working on that. It's the only way that we can reopen. And if you look at these numbers, that's basically a 2-week period of time from April the 10th to April the 27th. You can look at the Kent County numbers and the Newcastle County hospitalization numbers, and they look, reasonably moderate when you think about what we've been through, with just kind of gradual increases over a 2-week period, certainly not the surge. And then you look at Sussex County and you see that. And by the way, when I want to get a real sense, the beauty about Delaware is when I want to get a real sense of that, what's happening on the ground, I just pick up the phone and I'll call Penny Short at Nanacoke, and I'll call Terry Murphy at Bay Health, and I'll call Dr. David Tam at Beebe, and I said, tell me what your emergency room looked like over the weekend. And so we get a very real feel for the situation on the ground, because this is really the people that are most seriously ill, and it gives us a way of doing that. And that's been our focus kind of all along: preserve the hospital capacity so that we can treat those who are seriously ill, prevent those from seriously ill from dying, provide critical life-saving services in the hospitals. And our hospitals have been doing a really tremendous job treating patients and clearing their hospitals to make room for these patients and for any surge that will come, and doing all the testing to enable us to move forward. So I just wanted to point that out, because as we test more, we're going to have more positive cases. But when you get right down to it, those are the numbers that are a measure of the seriousness of the illness. So with that, I'd open it up to the press, and thank everybody for coming again and for your questions.
Hello.
Hi, Meredith.
Hello. I wanted to ask, the CDC issued guidance, I believe today, regarding agriculture and particularly poultry plant workers, that if they have a potential exposure and are asymptomatic and with protections in place, they are allowed to work. I'm wondering, just with the concern about asymptomatic spread and knowing how prevalent it is in the state, but particularly Sussex, is there a concern that this could potentially backfire in the chicken processing plants about allowing people who might have been potentially exposed but aren't necessarily showing symptoms to return back to work?
Yeah, so it's a really important question. I'm going to turn it over to Dr. Rattay, just make a couple comments. We struggle with this issue because of the kinds of testing that we're doing and the fact that you're pretty sure about a positive test. and there's no disagreement that somebody who tests positive, shouldn't go to work and should go home and self-isolate, and that's where our community focus is. The question is, what about the people that are negative? With these rapid antibody tests, it leaves you with a little bit of an uncertainty there, and so that's where we've tried to manage the risk, and we've worked with CDC in doing so, with the employers themselves in doing so, and come up with, I think, a really good approach to it, and Dr. Rattay gets real technical real fast in terms of these antibodies and what's present and what's not, and I shouldn't get into it anymore, but it enables you to kind of minimize the risk. And the question that you always have is, what's the safest place for those individuals, right? Particularly depending on whether we know they're positive or uncertain about what their condition is. And I say that because we know that the environments and residences that folks live in are very crowded and hard to social distance, and that's why we've stood up a hotel to help self-isolate. And that's why we're imposing really significant, and you mentioned the guidelines that CDC put out about those restrictions, on the line in the plants. And our effort now is really going to be to enforce those more rigorously than I think in the past.
Thank you, Governor. And I'll add to that, we've been working with the CDC for a number of days on this. So, as we went through their new guidance with them last week, it was clear we actually had already implemented pretty much all of that. And still this had continued to grow and increase while these mitigation and social distancing measures had been put in place. So as the governor was saying, now, an important piece of what we're doing is really on-site, better understanding, okay, so face coverings are required. Are they being worn appropriately? Or are people doing hand hygiene as they should? To answer your question about asymptomatic workers, I think, again, this is pretty new information. It's been evolving, obviously, but recognizing how common asymptomatic spread is, and with some of the testing we've done already, it's clear that that is what has been happening in throughout our state, but in the settings where there are large numbers of people working. And so we're working with CDC on our testing protocol, but they are supportive of our approach to have asymptomatic individuals who are tested positive removed from work for a week, and also have them be in isolation so that they don't infect other individuals.
And about nursing homes, I wanted to ask, for those who live in a nursing home or another long-term care facility, have coronavirus, are hospitalized, then recover and brought back to where they live, is there any concern about the capacity that these nursing homes have to care for these individuals, considering even the great nursing homes are still seeing this virus spread throughout these facilities? Is there any concern that these nursing homes just simply can't accept or handle people coming back?
I would just say two things and hand it back to Dr. Rattay. One is that there's been some hesitancy in accepting patients back to the nursing homes, and of course hesitancy on our part, making sure that the other patients would be protected as they move back there. And so we have arranged for alternative treatment or placement sites, I guess, at Governor Bacon to take some of those patients because they don't need hospitalization anymore. And so they're taking up room in the hospital, and so we're trying to help there, and maybe they're not ready to go back. The one challenging thing that I've learned is that there's a trauma that goes along with transferring these fragile patients from place to place, and they get familiar with different settings, and something we're trying to be sensitive to.
Yeah, there's no one answer, because I think every individual, every facility is different in what they feel capable of handling. Quite frankly, we've done a tremendous amount of on-site and, telephonic training and technical assistance, and a number of other measures that we've put in place. But we don't want to certainly require a facility that doesn't feel comfortable with a positive patient who is still, actively infectious, back into their facility if they're not comfortable with it. And so, as the governor was saying, we feel that it is important to have options. You have to weigh a lot of different factors when these decisions are made, but certainly, we don't want people to go back to a place where, if they're not ready and prepared, we may see more spread of infection.
Just to follow up, to clarify, are we doing asymptomatic testing in these facilities, or is it still for those who are in these facilities, it's just those who are just having symptoms?
Yeah, so that's changing. Like, all of this is evolving, right? So before we were testing symptomatic individuals. With the outbreak investigation that we've been doing in these facilities, we're definitely seeing asymptomatic positives. And so as we go forward, broader screening, testing is going to be more important so that we can make sure that those who are positive are often cohorted in a certain location and cared for by the same staff, as opposed to those who are not positive. So that is a change in strategy, given the change in information about this virus.
And that change has made us really kind of double down on the messaging about social distancing, particularly when you're in the public, because you might be passing somebody who feels fine, doesn't feel sick, but might be shedding the virus. And one of the reasons that we've changed our guidance to requirement to do the mask wearing.
Christy Fleming from Town Square, Delaware says businesses and restaurants which are open must supply face masks to all employees by Friday. These items are extremely difficult to find in bulk, and when they can find it, there's inflated pricing. What plan does the state have to procure and supply masks to businesses, and does the state plan to help businesses with associated costs?
Yeah, so that's been an issue all the way through as we've recommended masks to be worn initially. First, there was a difference of change in position there at the CDC in terms of a recommendation. We knew that there was a shortage of masks and other PPE for first responders and hospital workers, and we didn't want to create any competition there for those masks. Now this new requirement isn't a medical grade mask, but we do want to help employers to meet that obligation, including the state. It was something that we kept in mind for that, and I think AJ has been the point person for the supply of PPE to all.
So knowing that, we signed this weekend and had to get them sourced for state employees by this week, we were successful in acquiring, I believe they should be in today and tomorrow, a little bit over 10,000 pretty quickly. We are going to work with the recovery team that's working on opening up the economy to see when possible and when it's needed to source and procure things maybe at a larger volume to make sure we get that here. So active conversations we have, and we'll provide them to state employees before probably tomorrow and Thursday. And then we're going to work not only for masks but other items that may be in high demand that we could use a greater purchasing power with, and then source fairly across the state as needed.
Tom Lehman from WBOC asks, some businesses have said they will defy the order on requiring face coverings. Will the state crack down on them? What do you say to those who think the order was too heavy-handed?
Yeah, I kind of alluded to that in the answer to the last question, which is, the CDC guidance has changed as we've learned more about COVID-19 and how it's spread, and that it can be spread by asymptomatic patients or carriers. And so we've moved towards recommending that masks be worn. And, I would just say to those businesses who would think about defying it, that the best thing that we can do now and in the weeks ahead to create conditions where businesses can actually be open is to reduce and prevent the spread. And one way of doing that is to have people wear masks. And the masks are as much or more, frankly, I've learned, for the non-mask wearer as they are for the mask wearer. And so those employers who are thinking that way should think about themselves and their own employees. And I think so much of what we do relies on voluntary compliance and again, the notion that we're all in this together and we're state of neighbors, and if we're going to get through this, we need folks to follow the guidelines and the restrictions, and if they do, that we'll be in a much better position because we've been able to prevent the spread by following the restrictions that have been put in place.
Melissa Steele from Cape Gazette has a question about the $600 federal benefit added to state unemployment. She asked if that's taxable, and if so, how much of the $600 should people be putting aside to pay their 2020 state tax bill?
Yeah, I used to be Secretary of Finance, and I learned not to give people tax advice, but my understanding is it's income, and therefore would be taxable. Everybody has a different situation in terms of their tax liability, but I don't think there's a requirement that it's withdrawn. I guess if the state includes it in our paychecks, and I don't know how they've decided to do that, then it would be calculated with respect to the tax withholding. But I probably shouldn't give folks tax advice.
Tim Furlong from NBC 10 asks if you could talk about the growing concerns of poultry shortages due to COVID. Delaware producers are apparently euthanizing a couple million birds because they don't have the manpower to handle them. Do you have any insights on worker attendance or food supply concerns?
Yeah, so a lot of questions there, let me start from the two last questions, which are worker attendance and food supply. I'm absolutely concerned about food supply. In fact, I think it was today that the president basically came out with a declaration that states were not able to shut plants down because of the food supply concern there. And so, our approach will be to keep workers safe, to test them as they're going into a shift. If they test positive, we know they're positive, and we'll send them home and they won't work. I suspect that the plants will have difficulty in staffing because already they have high numbers of folks they're out of work. I understand. We're going to work with them because we want the plants to operate. There's a reference there to euthanizing chickens. If you're not able, we got all these chickens now out on family farmers and growers across Sussex and Kent County. If they're not able to move their chickens on to be processed in the plants, then those chickens are going to have to be euthanized in some kind of way or dealt with there. We already know actually demand is down because the restaurants are down across the country, I'm told. And that's the reason that some of the companies have had to take some birds down already, significant numbers of those birds. And what that does is that backs up into the growers and our family farmers who aren't getting flocks. I was on the mayor's call today with all the mayors, and the mayor of Harrington wanted to know whether there was any government assistance for chicken farmers and growers because they were not able to get flocks from the integrators because they've slowed down production, or maybe they're not moving their flocks through to be produced and therefore not getting paid. And so it's a complicated and very involved food chain that goes all the way back to the individual family farmer and grower across southern Delaware.
Amy Cherry from WDEL asks, what other metrics are you considering to start the reopening process since we have lags in receiving testing results, and as testing increases, we'll likely continue to see cases increase?
Yeah, so those are the two, I'll make a couple comments and then turn it over to Dr. Rattay. Those are the two, factors that we really need to correct for in our data. And we'll start producing a bar chart, I think, that shows where we are on those calculations so that folks can track it on a day-to-day basis. But what CDC is recommending is 14 days of improving conditions, however you define improving conditions. Their initial referenced was to declining daily number of cases. Well, we're doing more testing, and so we know that we're going to get more cases. What we need to know is that the percentage of positive cases as per that total being tested is declining and is lower. So we actually have fewer cases as a percentage of the population being tested. One of the reasons I wanted to go back to the hospital slides to really hone in on that as a key indicator of improving conditions on the ground, where we're seeing a decline in hospitalizations or certainly a leveling out of hospitalizations, because we know then that the seriousness of the viral spread is manageable. It's not increasing with respect to hospital capacity. We know that number because it's discrete, it's hard, it's there every day. They count them in the hospitals. There are some patients that are in the number or not who are probables, and we factor that into it as well. But we need some really hard criteria, and we will start showing that to get to that point where we can start reopening in a phased way.
Yeah, and I'll just add to that, and we just were having a conversation a couple hours ago with some CDC experts in this, and they really emphasize that you can't just look at one indicator. You need to look at multiple indicators. But when you've hit your peak and when you're on the other side, you're going to have multiple indicators that are telling you. So we look at something called COVID-like illness in emergency departments is something we're now tracking. Of course, cases we've talked about, percent positives, we've talked about hospitalizations are key, but also, as the governor mentioned as well, do we have enough PPE? Do we have hospital capacity are also important indicators. So all that has to come together in the decision making.
Yeah, and I would say, just to underscore two points that are really, really important, is that we can't move to reopening until we have a robust test plan and a deployment of that plan in our communities. We've got great partners with the hospitals. They're willing and able and ready to go into the next phase. We've got great community partners, and that's a critical component. The CDC says you can't move forward unless you have that, and we wouldn't anyway, because we know that if you're going to allow more people to circulate publicly, you're going to have to be able to identify those people who are carrying the virus, who are shedding the virus, so that you can isolate them, let other people circulate, identify contacts. If they test positive, test them. If they test positive, isolate them, and contain the spread that way, as opposed of the blunt instrument of just a total economic shutdown. That's the theory behind it. So you can't move into that first phase until you're ready with the testing and the contact tracing piece of it. So that's really critical and important.
A related question, Delaware Public Media asks where we stand on contact tracing capacity. Is there a plan to hire and train additional tracers? And if so, how many and by when?
Yeah, so the answer is no, yes, and yes. No, we're not ready. Yes, we need to hire more. Yes, we need to build that, as I said. And that's going to be a critical piece of being able to move forward. Other states, we're looking at what other states are doing. We've got some expertise that we've reached out to. Massachusetts, in some ways, has been leading the way there. Maryland has some interesting things they're doing. I don't know if Dr. Rattay, you want to comment on any of that. We have a lot of work to do there, but I think we have some good models, but we have some significant ramping up that we have to do.
Yeah, I mean, I'll just add to that, it's obviously critical, and we're looking to hire probably somewhere around 200 people to do this work. So it's a big undertaking, but it's obviously important, which is, why we want to hire so many people.
Jared Leedy from WRDE asks, is there any comment on J1 students? They're international students who come over the summer to work, especially in southern Delaware. Will they be allowed to do this if and when Delaware reopens, or will you take extra action to prohibit them from coming?
Yeah, we've heard this question before. It's a little complicated. Right now, if they were to come, they would be subject to the 14-day quarantine. That's something obviously we'll be looking at over the next several weeks, particularly as we hear things from other states. One of the big questions that's coming at us quickly is the summer season, the summer tourist season, the summer beach season, and all the visitors that come to Delaware's beaches. Are we going to open the beaches? When are you going to open the beaches? What about summer camps, summer school? All of those questions need to be answered. So I don't have a specific answer to the J1 question, other than at the moment they'd have to, if they came, they'd have to quarantine for 14 days, and the businesses that they would normally work would not be open. When they might be open is still a question we're trying to sort out. The sooner we could do that, the better, but we also have a very serious issue that we're dealing with in Sussex County there with respect to the outbreak.
This is the last question. It's from Delaware Public Media. They asked, are you satisfied with the level of outreach and communication to Black communities in Delaware? What partners are you working with to make sure information is actually reaching people?
Yeah, I think we have a lot more work to do there. Obviously, we've seen higher infection rates in the communities of color, both the Latino community and the African American community up and down our state. We've been building an outreach team and working with Dr. Rattay, Secretary Walker, and others that have been redeployed from other efforts that were underway prior to the outbreak. A lot of outreach going on, which started initially with the homeless community in each community across our state, and we've used some of that infrastructure to engage minority communities. We do have contracts with minority businesses and media to do some of that work and translation work with respect to the Latino community, but we do have a lot more work to do to get the message out, to support communities, to get testing to communities that need it. We're going to work really hard on more community testing sites. We've done that mostly through Christiana Care. BB Hospital is going to move to do those sites, as are Nanacoke and Bay Health there in Milford, and both sides of Milford, Kent, and Sussex County, and then the hotspot towns there in Sussex County, and more community sites to make sure that Delawareans who are at risk are getting tested, and that we're getting information and care kits out with hand sanitizer, with masks, with thermometers, different things to help people keep themselves safe. Dr. Rattay, lots of work going on there if you want to add anything to that. We're also using data to identify those sites. We're working with elected officials to identify those sites. Got a series of recommendations from the Legislative Black Caucus this week. We've got phone conference calls with community leaders across our state coming up this week and next, and doing a lot more outreach there appropriately as we work on the serious outbreak in Sussex there.
Yeah, I'll just add, we, for a couple of years now, have been working on an initiative called Healthy Communities Delaware, and which is an initiative to address health equity, and much of the focus has been in working with communities, especially communities of color. And so really building on that work, our testing work and our contact tracing work, we're going to have a ground force that is going to be really helping us work with those communities to better understand needs, to better understand how to reach people, to contact trace people. So it is, it's very important, and we still have a lot more work to do.
Yeah, and I mentioned the two-track approach in terms of testing at work sites in Sussex County and community outreach, and we're engaging the community partners down there, particularly those with trusted emissaries into the communities and the faith communities as well. So a lot of work to do there. So that wraps it up for today. Again, I want to thank all of our partners. I want to thank again the Thunderbirds and Blue Angels for saluting them today with their flyover. Really a nice gesture for those workers on the front line. And want to again emphasize for all of us that we have these restrictions in place. The stay-at-home order is still in effect. Please try to do that. Get your exercise, get your walk in, stay separate from others as you do that. If it's out at the local high school track, or if it's in one of our parks or trails, practice basic hygiene, constantly washing your hands, sanitizing surfaces that are touched a lot, keeping your hands away from your face and eyes, protecting your neighbors, particularly our senior citizens, and working together, we're going to get through this. So thank you all, and we'll talk to you the next time.